welcome everyone. Looks like we've got a good group of folks joining. We're really excited to launch into this first Learning Academy. You are here for the inaugural session of the inaugural Learning Academy. So with that, Lisa, do you want to go to the next slide, please? So we'll run through the agenda really quickly. Lisa Hong will start us off with some housekeeping. We'll have a welcome from Ken Harris, and then we'll run through some introduction to the Healthy Start QI Learning Academy, and then we'll jump right into the content, and we'll turn it over to Jane Taylor, who will take us through this first Learning Academy session, and then we'll wrap up with just some homework and next steps. So that's the plan. Next slide, please. So Lisa, I'll turn it over to you to just remind us all of our meeting logistics for today.
Great, thank you, Nikki. Hi, everyone. Again, my name is Lisa Hong, and thank you for your attention as I review some housekeeping before we begin. For meeting logistics, this session is being recorded and will be posted on the EPIC website for future viewing. All participants are muted upon entry, and we ask that you remain muted to limit background noise. We encourage the use of the chat box to ask questions or post comments. All questions will be captured from the chat box, and we will address as many as we can. For audio, if you can hear me, you're likely connected correctly, but we'll do a quick review. After you join the meeting by clicking the meeting link, an audio conference box may appear. You can join by either computer audio or phone. To join by computer audio, click computer audio and you should be all set. To join by phone, dial the given number, enter the meeting ID and press pound. Then enter your given participant ID and press pound. You will then be connected to this session's audio via phone. Lastly, we'll review how to participate via the chat box. To access the chat box, click on the chat button on the bottom in the bottom of the toolbar of your Zoom screen. A sidebar will appear on the right. Type your questions or comments into the chat box and send them to everyone. Again, we encourage the use of the chat box for any questions or comments during the session. Thank you for your attention, and I will now turn it to Ken for the welcome and introduction.
Thank you so much, Lisa, and thank you, Nikki. So we are excited, as Nikki said, this is our first ever Learning Academy, and it's something that TA and Support Center is introducing to our Healthy Start community. And so we're really excited to offer a different way of learning and then moving ourselves forward. And recognizing that everyone's very, very busy, and especially in the last year or so, we've taken in so many webinars, perhaps, lots of conferences, lots of information we've taken in. And as you've gathered all that information, many times people get stuck on how to move it. And so we really are believers in moving data to action. And so this Learning Academy is to, not just go with the breadth, but the depth. How do you really get into moving data and moving to action? And so we're really happy with this first Learning Academy to be on quality improvement. We're really happy to have our improvement advisor, Jane Taylor, that's been working with the center over this past year. And it's just great to have her again for our first Learning Academy. So today, you're really going to get an idea of going into the depths of really what this work is about and how to move your data to action, and hopefully, and I know Jane's going to do a great job in making you feel comfortable in testing things out and know why it's important to test little things, even a little idea, and being more confident in trying some things out and really moving our data to action. So we're really excited. Again, welcome. You will be remembered in history because you're the first group to get a hold of this Learning Academy, and we're hoping that it's going to be a great feature to have for our Healthy Start communities as we continue as your TA and Support Center. So thanks again for being here today, and thanks to all of you. And Nikki's going to kind of go through the depths of really what a Learning Academy is. So Nikki, I'll kick it off to you.
Sounds great. So next slide, Lisa. And yeah, just again, welcome. Feel free to introduce yourself in the chat. We've got a good little group of folks here, so we want to know who's here and introduce yourselves. So next slide, please. So what is a Learning Academy, right? So this is a new term. We haven't done one of these before, but this is how we're describing them. We're saying that this is a place, an opportunity for you to take a deep dive into a specific topic to prepare you to apply those learnings in your day-to-day work. And we're going to do this through a series of monthly lectures. There'll be required readings, some assignments. We also are hoping that you'll all be working together in our collab to talk about what you're learning. And we're hoping that these will be evidence-based practices that you'll be able to build on and incorporate into your work. Next slide, please. So again, we talked about this, but what are the different pieces of a Learning Academy. So you'll be seeing us on these monthly webinars, which will be lecture style. Jane also is very interactive, so it's not just going to be a lecture. You'll also have some required readings. There'll be homework assignments. Again, using that collab as a space where you all can engage and talk about what you're learning together. And then in the future, we are really hoping to put all these sessions up in an e-learning format on the EPIC website so that folks who aren't able to participate in the live sessions are able to go back and really participate in the full Learning Academy and do each session in a row. So next slide. So we're going to transition to talking about this Learning Academy. So those are Learning Academies overall. And so today we're really focusing on the Quality Improvement Learning Academy, and this is the first one that we've done. So in terms of the overall series, the goal for this is to build the grantee knowledge and develop grantee skills around quality improvement, to support them in executing a QI project with an equity lens, achieving their programmatic goals, and meeting the Healthy Start benchmarks. So that's our aim for all of the series. Next slide. And like we said, there'll be 5 different webinars or lectures as part of this, and then there will be work between each. But you can see here that there's about 1 webinar a month from February, this is our first one, through June. And we really do hope that folks are able to kind of continue with us on this learning journey and participate in not just one session, but stick around for kind of each of them. And they will be posted, but we really do hope that you're able to commit to doing all 5 with us. So next slide. And so today, in our first session, we wanted to just lay out the learning objectives connected to this, and Jane will likely go into this a bit more in her content. But right up front, these learning objectives for all of our work today and discussion are to state the 4 components of the philosophy of improvement, to identify 2 or more questions of increased shared power, and use 1 or more tools to generate inclusion and shared power. So that's what we'll be learning today. And next slide.
Hey, Nikki,
Okay.
before you
Yeah.
say the great things about Jane, let me just interrupt. And I don't know if Jane knows Dr. Art James or not, but I just want to give honor to him. He's actually on our first QI Learning Academy, which I think is exciting to have Art part of today's conversation. So if Jane doesn't know him, he's another great person. But if you do know him, you already know. But I just want to acknowledge and honor him being with us today. Thanks.
Well,
Thanks so much, Ken.
thank you for that, Ken, because I know of Art because when we kicked off the infant mortality coin, he was a big part of that. And I sat in the audience and kind of oohed and awed. But I didn't, I'm sure that he doesn't recall that. But Art, thanks for coming. It's great to see you again.
Well, Jane, before you jump in, I got to say just a few words and then I will turn it over to you. But if you don't know Jane yet, I don't know where you've been in this Healthy Start TA and Support Center, because Jane is one of our rock stars, and she has been doing such amazing work with all of the grantees around QI, both in one-on-one TA as well as providing many all grantee webinars, speaking at the grantee meeting we had. So if this is your first time in one of Jane's sessions, you're in for a treat. But Jane is one of our faculty planning committee members. She's also our resident QI expert that we all go to. So with that, Jane, I will turn it over to you to kind of lead us through the rest of the content for today.
All right, great. Thanks, Nikki. And I just put in the full disclosure that this photo was taken 1 month before we went into lockdown. And when I look at how dark my hair is, I'm quite shocked. So I know many of you have shared this part of that journey with me. I do want to ask Lisa to turn off the slides for a second so we can just all look at each other. And if you possibly can, turn your camera on just so we can see each other. I really like to have a feeling for the room since we can't be together. Thank you all so much. We won't do this, but maybe just at the beginning or the end. We have so many people, we're going to fill up 2 pages. So this is awesome. I hope you're recognizing some of your virtual colleagues. I'm on the 2nd page now. We have a lot of folks that are still popping up. Oh my gosh, LaShonda, you look cold. I know it is cold. I shouldn't say that. I'm sitting here in Minnesota with a heating pad on my lap. All right. Thank you all so much. And if you will give us back to the slides, that'd be great. Lisa, thank you. So I had a choice when we set up this program. One was to do straight up quality improvement, and another was to talk about how quality improvement is really well situated to deal with structural racism, to help us uncover hegemonic power, the kind of power that hurts us, to think about the philosophy of it, not just how to do it, and what kind of a cultural change it can make. So when I set out at the beginning of working with Healthy Start, I really didn't realize that I was entering on an equity journey that would change my life. And I undertook, one of the promises that I made to myself was that I would find a way to integrate the fight that we all have, or the struggle we have with structural racism and oppressive power, and find a way to integrate that, liberating approaches to that inside quality improvement. And I think that there are a lot of places where there are connections, and there are some disconnections that all of you are going to help me with, because you live the lived experience, and you are expert in this as well. So I'm hoping that we can do this journey together. This is the first time that I've attempted to do this in public. And so I may have bit off too much for us to do, but whatever we don't get to today, we will come back to it in the subsequent Academy sessions. And I put together, there's 50 slides here. They are too many, but I wanted you to have some tools at the end of the workshop that you could experiment with afterwards. So I wanted to at least make those available to you. Now, can I flip my own slides, or do I depend on you?
You can tell me to move to the next slide, Jane.
Okay, go ahead, next slide then. So before we get started, we're going to go into breakout rooms. You're going to have 8 minutes. And here's the question that you will share. This is our icebreaker. Next slide. I'm going to randomly assign you in groups of 4. So you'll have 2 minutes each to say not what you do, but who am I? Who are you? Where do you live? And the best advice that you ever got. So are y'all ready? Prepare to be thrown into a breakout room with somebody you don't know. I hope. Have fun. We'll see you in 8 minutes. Just so y'all know, this will be part of our regular gathering routine. You'll be thrown in small groups at the beginning for an icebreaker, but every time we'll have a different question. But I hope that you made some connections. I'm a firm believer that the way knowledge is shared is not through a fancy knowledge management program or knowledge management website, but by rubbing elbows with each other and knowing what you're doing and knowing who to pick up the phone and call. So I'm trying to create space for that for all of us in this virtual world that we live in. Next slide. So why are we here? Well, I was thinking we're here to set into motion, to unleash the power of quality improvement in service of equity, inclusion, and the value of diversity. But I like the words of my mentor, W. Edwards Deming, and he said he would open every workshop he ever gave and with this question, why are we here? And his answer was to learn, to have fun, and to make a difference. And I think we are making a difference. And my hope is that by integrating equity into quality improvement, we can even make a bigger difference. So I want to start with where some of the most obvious intersections are between the equity perspective and quality improvement. And I think the first one is this idea. In quality improvement, we would say, who is the customer? In equity, we would say, who are we serving? And who are we centralizing? Who is this for? And that's the most fundamental question I think that we'll ever ask in equity. And then a following on question is who has influence? And if influence is of value to a group, how can we expand our influence? How can we push out the boundaries of our influence as we learn how to dismantle racism? How can we expand that influence? And this idea that we are here to learn and judge. And so data is for learning, not for judgment. And that is such a big shift when you are required to submit as many reporting requirements as you have to your funder. And you are judged on your performance because the data that you're really collecting is for accountability. And it's really not the same as the way we collect data for learning. But I think this idea of learning and not judging data and not blaming each other when things go wrong is one of the strengths of quality improvement. And I was reading on a website about how to know, it's like how to identify when you're being a racist. And one of the things that the author said was, if you find yourself in a blame culture or you find yourself blaming other people, you're acting out racism. And one of the things that Dr. Deming was really clear about is every system, as Paul Batalden said, is perfectly designed to get the results it gets. And that when there's something goes wrong, 95% of the time or more, it is the way the system was designed or the process are operating. It's not because one of us messed up or one of us didn't do what we were supposed to do. When we can liberate ourselves from blaming each other, then we can drive out fear. And when we can drive out fear, we can all be, I think, come to the table as our very best self. So improvement is also learning centric, and I think equity is the same way. We are both client centric, and quality improvement is based in American pragmatism and in this idea of promoting democracy, not just for the United States, but actually the idea with the early progressives was that we would spread democracy worldwide so we would never have another war like World War I. So some of these pragmatic, very early articulated values that informed improvement science are resonating strongly with an equity perspective. And please, if any of you have a different perspective, I want to welcome and honor and make place for you to chat that in or to come off mute and interrupt me. And that's just fine. So if you
yes,
say,
I
yeah,
would like
please.
to say that there's sometimes history is looked upon as in being consensus history or conflict,
Mhm.
and given the school of thoughts or the platform which one is standing, one would have a different articulation of what's going on. So Yusuf Kly, KLY, spoke about the antisocial contract. So it's not just a question of being someplace, but how did you get there? And for African people, we will get here through international crimes of kidnap, of
Yeah.
transport, and enslavement. So that whole history is a history of not of democracy, because democracy asks that there's informed consent. We were not informed, nor do we concede or give consent. So to say that there's a pragmatism about the parallel uh, alignment of pragmatism and what we want to do inside of Healthy Starts, I see them to be quite different because African people were enslaved and we've gone through 400 years of discrimination and oppression. So I see it from a different angle.
Yes, I certainly see that. Thank you. Thank you. I will be, I will do this right now. Thank you. And you're getting some here's, so thank you so much. All right. And that's very helpful. I really appreciate it. Next slide. So there's some basic principles for improvement. And one is that the client leads us and everything we do is driven by that. That we work to optimize the system and to create alignment between what the people that that we serve or that we're here to that receive benefit from what we do is that we can work to make the organization do that, the system. And also that we can continually improve. It is possible to do that when we put ourselves to work on it. We can continually learn, and we can manage with knowledge, collaboration, and mutual respect. Next slide. So there are, I think, some more intersections, and one is this idea that leadership is really accountable. And because leaders are the ones who create the systems that we find ourselves in, that they have an accountability to dismantle and change those systems, and that we want and seek out a diversity of perspectives, that the more diversity we can have, the richer our views are on any one issue, and the more choices that we have about the things that we want to create. Now, in improvement, we believe that variation exists, and that is part of the human condition, and that we are all different. And I know you've heard that no two snowflakes are alike, and yes, we are all different, but understanding variation is a key component of quality improvement. And I think that it also resonates with this idea of diversity. And then in improvement, in the philosophy of improvement, there is a value on intrinsic motivation, that when a normally, typically developing child is born, it learns to sit, it learns to turn over, it learns to walk, it desires to speak, it is intrinsically motivated, and that we drive that out of ourselves systematically through our school system, through the way that we reward and punish in our society, and that one of the best things that we could do, most useful things, is try and instill intrinsic motivation, find our intrinsic reasons why we want to do something. And then this idea of constancy of purpose, and I think Healthy Start is a great example of constancy of purpose. It has survived a long time. And it is a constancy of purpose and a commitment to its mission that makes that possible. And the fact that all of you continue to do the work, even during the pandemic. And this also, another intersection, I think, is teamwork, that we have to work together to do this, and that the competition can be really destructive. Competition is fine if I'm on a sports team, that there the objective is to win or lose. But when we're working together, if we start competing with each other, we could actually, that means that one of us wins and one of us loses. And it's really hard to be in relationship with a loser where someone's up and somebody's down. So in improvement work, we really try and stay away from this destructive part of competition. Next slide. So there's some things from adult development theory that I wanted to just surface here. And this is based on Jack Mesereau's work, but it's called transformative learning because it really is about transforming yourself into a developed adult. And I was thinking about equity and wondering if some of these things might not apply. So what Jack Mesereau said is that as we develop, we become more permeable. That is, we become more open to different perspectives. We become more inclusive. That is, we want to have a broader perspective. And we figure out how to integrate our experiences with the current situations and contexts that we're in. And we begin to be able to differentiate that what's good for the goose is not necessarily good for the gander. That because we are different and because all our contexts are different, things will be different. And we can't approach everything with one perspective or one grand narrative in mind. And then Mesereau said it's really important for us to develop habits of being critically self-reflective, where we learn to challenge our own assumptions and either affirm them or reframe them. And usually it's for the purpose of reframing some basic held beliefs that we have that we might not even be aware of that we hold. So I thought this had some applicability to the equity work, and it definitely connects in with good improvement science. And I'll just pause here for other comments and different perspectives. Make some space for you. All right, let's carry on then. And I'm not going to be lecturing for too much longer. We're going to do a little bit of work in just a minute. But Deming developed something called a system of profound knowledge, and he purposely called it profound because he said that if leaders and managers could learn to embrace this philosophy, it could transform, again, that word, management and leadership. And so he developed 4 parts of his philosophy for leadership transformation. And one is appreciating a system. That means understanding its components, understanding how they decide to work together for a common aim, making trade-offs among the components to prevent suboptimization of the system. So there's a lot about systems theory in improvement work. The second is really understanding variation. What is variation telling us? Are we really improving or not? Do we have a problem?
Of health standpoint.
Do we have a problem?
Jane, sorry, you became unmuted
That's
or
weird.
muted.
Where did I stop talking?
The variation.
Okay, so knowledge about variation, and we're called on to understand what the variation tells us about a process's performance, and we're called to ask ourselves, are we improving or not? Are things getting better or not, and how do we know? Are the changes that we're making really making a difference? And if so, to whom? And then theory of knowledge is just this idea that we can make the road by walking. This is something that Paulo Freire, who is a liberatory adult educator, developed, this idea that we can make the road by walking. So the theory of knowledge is just this scientific method that is used in everyday things that we do, where we try something out that we think is a good idea. We try it on a small scale, and if it works, then we say, it works in this context. What are some other conditions that we might try it under to see how robust an idea it is? And we learn our way into what's going to work instead of imposing an implementation strategy on any system and expecting everything to just go marvelously. And then that finally, this idea of psychology and thinking about how we're different, thinking about what motivates us as individuals, but also thinking about how our society behaves and how what is the psychology of change. So that is the philosophy of improvement science, and this is what I would like to bring, a habit of equity interrogation to this work. Next slide. So Dr. Deming created 14 points before he came up with those 4 parts of the philosophy. And I just want to go over them. I have them in a handout for you, but the 14 points are: create constancy of purpose, so that the aim of what we do is not changing all the time. This allows us to focus on it. Adopt the new philosophy, that is the way of thinking that I just described. Stop inspecting. Sometimes you need to inspect for safety reasons, but usually when you're inspecting, it's too late, so you need to design in quality. When you're working with your suppliers, minimize total cost and collaborate and cooperate with your suppliers. Continuously think about how can we improve the services we're providing, and make sure that everyone has the training they need to do their job. And he used to say that the average person should be able to do a job, and if they're trained well, and then it's really on leadership to make sure that you're properly trained when you're given a job to do. And then he said, it's not enough just to like use these 14 points as a checklist, but you really need to adopt and institute leadership and put these ideas to work. And the other points are on the next slide. Drive out fear, because if we're afraid, we can't do our best work or be our best selves. And that we need to break down barriers between departments. And even this word department, you know, it's like pulling things apart. D means apart or away from, and part is part. So even the very word department suggests that we're going to have barriers between ourselves. And so he suggested that we start cooperating and collaborating towards that constancy of purpose and that shared vision and aim of what we're trying to make. And likewise, that we can't motivate people with slogans and exhortations or arbitrary numerical goals, that really we have to instill this intrinsic motivation and get rid of barriers that rob people of joy in work. And as I do TA with some of you, I am really surprised by some of the barriers to joy that you have in your work and some of the constraints, tough constraints that you work under. And I really admire and respect the work that you do, and how some of those elements could be barriers to joy in work. And anything that we can do to reduce that is a good thing. And then institute programs of education and self-improvement for everybody, and kind of institutionalize that. And then put everybody to work on transformation. It's not enough for leaders, just leaders to do it, or not enough for leaders to say, here, staff, you all go do this, and let me know when you're finished. That's not it. We're in this together. Next slide. So then Deming kind of codified these 14 points into this system of profound knowledge. And he called it a system because he said, we need not be expert in any one of the 4 components, but we need to think about how these components are interacting with each other. So when we're looking at data, we need to think about what is the system that this data reflects? What is the system we're trying to create? What kind of changes are we making? That's theory of knowledge. How is it going with the people and for the people? And that's psychology, and that these are always interacting, and that what was important would be to think about the interactions of these 4 components. So what I really want to do is figure out a way to connect equity with this and take the tacit aspects of it and make them explicit, so that we can begin to really harness some of the power that's in improvement on science to make change. Next slide. So I was lucky enough to get exposed to an organization in Canada called We All Count. And so I want to acknowledge this is a photo shot from one of our slides that we had in the workshop. And they taught me a lot about thinking about power, and they call this a funding map. It's really a power, influence, and data map. And the way that this works is you have influence, money, and data. And they are all different. I'm going to grab my pointer here, if I can. So, oh, that's interesting. I can't. Try this. Here we go. Influence, money, and data. And they're represented with 3 different colored arrows. And you start with who is the funder, or in this case, the example they gave was a large foundation. For us, the funder is the Maternal and Child Health Bureau, or HRSA. And that group exerts influence, and they also assert money to a national not-for-profit, who also sends money to a local not-for-profit and asserts influence on that local not-for-profit. So basically, the way that you make this map is you say, okay, who influences whom? Does the large foundation influence the national, or does the national influence the large? And you draw the arrow headed in the direction of influence. Does the large foundation influence the local, or does the local influence the large? Oh, here's city government. This was a project in New Orleans. Does the city government influence the local not-for-profit? Yes, they do. But you see there's no arrow flowing back, and there's no arrows flowing from the city government anyplace else. So you go through this example with your stakeholders and your funder, and you do the same thing for money and data. And one of the things that a map like this shows is, one, who has the most influence, and are we happy with that? So when this map was laid out and there was a transparent conversation discussed with the large foundation, the foundation realized that they may be influencing too much on the national not-for-profit, and that the local nonprofit might have been overly influencing the data collection group. So, but you can see here that the city residents that were, this was to study city residents in New Orleans, they're giving data to the data collection firm, but they're not getting a thing back. They're not getting influence, and they're not getting data back even. And so this will show some of the power dynamics. It's the start of thinking about equity and data. So most of the people I work with who are thinking about equity and data are thinking about stratification of data by race and ethnicity, maybe by income and sometimes by geography. But never have I heard them say, let's look at how influence, money, and data flows as a way to start thinking about equity. Are there any questions about this? Because we're going to go into breakouts and do an exercise in just a moment.
I don't have a question, but I would like to, when you was talking about knowledge,
Yeah.
that in many of the communities that we serve, the indigenous or local knowledge of those communities haven't been respected or included in terms of collecting their opinions and their worldview. So by their marginalization, we're kind of like we're working in the blind,
Right.
because we're not even including the knowledge base of the communities in which these individuals live. So I just wanted to kind of say that is another way of exclusion, because you talked about equity, but we
Right.
can't have equity if we don't have inclusion.
Exactly. Thank you. That's exactly right. And what a loss that we don't have these perspectives, because they're rich and we're missing out. So let's go to the next slide and I'll tee you up for your exercise here. You're going to go into breakout rooms for 12 minutes in groups of 3 people. You have in the chat a link to this power mapping tool. But one of the 3 of you will volunteer to work on a map for your organization. And one of you could open up this power tool and share your screen and construct a power map. And the idea is to do one domain at a time. So do influence and then money and then data. And the questions you ask are, does X assert influence over Y? Does the national assert influence over the local Head Start, or does the local Head Start assert influence over the national? And you could do this for a group of your own stakeholders. I think I have 7 balls in there for you. You can add more if you want. And then how does data flow and how does money flow? Then I would like to have you all come back and sort of share your insights, questions, and interesting relationships that you saw. And I'll just pause here to tell just a quick story about, I was working on a very conflicted project, and there was a group of funders, some of the wealthiest funders in the country, that had funded this project. And they were very committed to traditional research models where everything has to be evidence-based and everything has to be validated tools. And it wasn't really about learning, but it was about having some kind of fidelity to their mental model. And the group I was working with was saying, well, there are alternative ways to do this. And if we're constrained by what's evidence-based or what is a validated tool, we're not going to learn what we need to learn to be successful in this project. And to make a long story short, when I saw this power mapping tool, I wept, because I realized that if I had had access to this tool at the time, we could have mapped power and influence and money, and we would have seen that the organization I was working with was completely hamstrung and really was painted into a corner in a way that the project wouldn't be successful. And in the end, the project got defunded. And it was really sad, and it was a real loss to families. So when I saw this tool, I thought, wow, this is a great tool. And that's why I'm bringing it to you today. And I would like your feedback on whether you think this is a useful tool, and if so, how you might use it in your local community. Are there any questions before we go into the workout? Okay, you'll be assigned randomly again. So click on the mapping tool handout, and there's no right or wrong way to do it. Just see what you can do.
Jane, before everyone goes into their breakout rooms, if I can just demo what they will see when they open up the document. Yep. Hi, everybody. So if you were able to access the document via your email or the chat box and you're able to open it, it will look like this. And what you will do is click at the center of each circle and follow Jane's directions, which are at the bottom of the page, and label your stakeholders, you as an agency, as well as your funder, etc. And then move the arrows as so, and you can change the direction and rotate it as you need to. And so continue following the directions that Jane has provided. And if you need any assistance while you are in the breakout room, at the bottom of your toolbar, you'll see Ask for Help. And when you click for that, invite the host, and Tess or I will join the room to assist you. Before we open up the breakout rooms, does anyone have any questions? Okay.
Lisa, did you say we were sent this in an email?
Yes, you were. I've also put it in the chat, and I will reinsert that into the chat box for you, Art. Any other questions before we go ahead and open up the rooms? Great. We'll go ahead and open up. And again, let us know if you need any assistance. Thank you.
Okay, looks like we have almost everybody.
Everyone should be back, Jane.
Thank you. So I'm really curious how that went, and I would like to make space to hear some reactions or insights from anyone who would like to comment.
I can share something. This is Gabby Gonzalez. My group was with Felicia and Esperanza. And as soon as we got in the rooms, I basically disclosed and was like, I want to be transparent. I am completely lost right now, just seeing all of these arrows. But as a visual learner, I felt once I kind of started and we talked out, kind of, do you think you would put this? It was a lot. It was really helpful. And even though we all came from different organizations from completely different parts of the country, we were oddly able to help out each other with similarities, such as, of course, Healthy Start is a big commonality, and community partners and resources. And now I just feel it really came together, and it makes sense when I was looking at it from the perspective of my organization. So now I'm feeling a lot better about it. So thank you.
Thank you. Someone else? Who else like to step into the space?
Well, this is Jerome Dowdell with Clayton County Health District in Jonesboro, Georgia. So actually my program director and I were joined by Jared in our breakout room. And what was amazing to me is that a lot of things that we think about in our heads and we talk about, but to actually see those bubbles and to actually see the influence and the interconnectedness, you kind of put everything in its proper perspective. And it just further illustrates that none of us are doing this work by ourselves. So I thought it was a great exercise. It really made it plain.
Jerome, what would happen if you sat down and shared that with your community partners and stakeholders?
I think they would. I think they benefit from it because they have a better idea of how things work. They understand that although we are passionate about our work and we love to provide resources and opportunities, that there's a process, and that we aren't the bearers of all the resources ourselves, and that we depend on our partners on a national and local level to get it done. I think that's what really would be helpful in a community meeting setting.
Thank you. Anyone else want to share?
This is Crystal from DC Healthy Start. I thought it was a great exercise, especially with the arrows, with money and data. I think it's pretty obvious, where those come from. But when it comes to influence, it was really good to see how much influence everyone has, and the way that DC set up. We're the grantee of HRSA, DC Department of Health, but then we have our sub grantees, and then our clients and the CAN and everything. So it was really interesting to see how much influence everyone has. So I thought it was a great exercise, especially regarding influence.
Mm-hmm. And Art's saying the exercise demonstrates the golden rule. He who controls the goal rules. And yeah, it will show up that power. Anyone else? Please.
I want to also add that my director did a great job with those arrows.
Great. Moving them around. Was there anybody that this tool failed for completely and you were like,
This is Christy Edmonds, Tulsa Health Department, and I was with Debbie. I'm not sure how to pronounce your last name, Debbie. Debbie Aguilon? I think I've totally butchered that.
That's fine. It's Aguillon, but everyone says
Aguilon. Debbie,
Aguilon.
and then LaShonda Tate. And we used Debbie's Healthy Start, Strong Beginnings out of Grand Rapids, Michigan.
Mm-hmm.
And we felt we had a success just in getting all of our circles filled in, and we even added an additional circle. In other words, it's like we just barely scraped the surface on this, and tons and tons of work left to do. But I was the one putting the information in the circles and fooling around with the arrows and stuff. So I felt like we just barely scraped it. It's a cool tool I'd like to see used in more depth within our own programs.
Mm-hmm. Great. Well,
she did a great job. She did a great job.
Thank you, Debbie. Anybody else? You'll have a chance to work with this in the action period between this call and the next time we gather for the action learning part of this academy. Anyone on the page 2 want to comment of our grid? Okay, let's move on. Thank you all so much. So what I was wondering about is, could we improve our project setup and the influence that is floating around because of money and data for a fairer result? So if we could make these power dynamics transparent and share them with our partners and funder, and we showed the influence on the project team members, and not only influence on the project team members, but on the people that we serve are the people who benefit from the Healthy Start services. And if we could show some of these power gaps and imbalances by the number of arrows, what might we be able to reconfigure for ourselves to make a fair result or maybe a different future for our work? And that's really what I'm thinking about is, are there people that should be getting funded that aren't? Are there people that we could think about, oh gosh, I didn't think that we might want to share data back with the residents of the city? So just using this as some way to think about power and influence and the flow of data. Because I don't know if any of you have seen this paper, Why Am I Always Being Studied? That's out of Chicago. And it's a really great example of how we study populations of focus and then we never do anything. So I'm all about let's change the world and as best we can. Thank you, Art, and have a good rest of your week. Okay, let's go on. So now I'm going to go into some of the components of the system of profound knowledge. So one of the things that Dr. Deming said is that all systems, man-made systems, have to be managed. Like natural systems don't need to be managed. They have a way of self-managing. But man makes systems, and so they have to be managed. And that every system has an aim, but that aim is always a value judgment. And that value judgment really depends on whoever is creating the system. And so right there, we have a place to start thinking about equity. And that the systems are made up of a whole bunch of components that are interdependent. So if you think of that ball, the balls you were just making, those are kind of components of some of your Healthy Start system. And those components are interdependent and they're cooperating towards this greater aim that we have. So how can we promote more cooperation and more collaboration towards that aim? And do we have a diversity of values or do we have a common set of values? And how do we make sense of the values that are behind the individual aim statements of your components, but also the overall aim of the system? And that some systems that we work in are complex. And that means, by definition, that there is a lag between cause and effect. So if we're making changes, sometimes it is very slow to see the effect because it's a complex system and the change has to be taken up by so many different components in the system. But that and also that some of the very solutions that we come up with are going to create subsequent problems. So just thinking about what are there other subsequent problems that we might be creating and how would we know? And how would we know as we work on one thing that we're not damaging some other part of the system or some other people in the system? So one of the ways that we think about that is in what we measure when we do improvement work. And that the sum of the parts do not equal the whole. Why is that? Because the sum of the parts is greater than the whole, because all the parts are interacting and they're amplifying each other or minimizing each other. So the sum of the part, you can't just say, well, the system is the sum of all the individual parts of it. And that as we think about managing the system, it really should be in service of whatever the value or the greater good of that system is. So these things need to just be articulated. And this is part of thinking about using appreciation of a system as a way to understand the challenges that you face, but also as you start to create new ways of doing things to be purposeful about it. Next slide. And so a system starts off with a design, like I want to make a Healthy Start agency, and I'm going to start with a design. But in order to make it, I need some suppliers and some supplies. And these supplies are going to have a profound effect on the service delivery that we make, because they're going to come together and they're going to interact. And this is how we do the work. We take our inputs into the system and we work with them and we produce something that we give to our clients or our consumers. But that's not enough. We need to find out, is this helpful? Is this useful in your life? Does this benefit you? And take what we learn and feed it back into the design and redesign of the system. And anytime we do improvement work, we can work on the suppliers. We can work on the conversion of how we make what we make. And we can work on whether or not it means something useful for the people that we serve. And even inside your agencies, this process replicates itself. So anytime you receive work from someone else, they give you a document, say an intake form. They are supplying you with that intake form, and you are their customer. So you have certain needs that you can articulate in a way you could say, you know what, I really need this form to be done slightly differently. And so you can help your supplier become internally a better supplier. Likewise, if you are handing your work off to another person, you could say, is this what you need? What else would be more useful? Do you have what you need to take the next step to benefit our clients? Oh, you need it a different way? I can do that. Or did you know I have something else I could do? Would this be better? So just starting to think about yourself and this kind of relationship can bring about improvements on its own. And Ken and I had a very interesting conversation yesterday where we were talking about the structures of quality improvement and how could we actually start thinking about improving as we start dismantling racism. How could we do a good job of the supplies that we need and the people we need to do it? And how will we know that we're building a better world and something that will benefit Blacks, people of color, and those who've been excluded and racially harmed by institutional racism? And I don't know, Ken, if there's anything you want to add to this conversation that we had about this, but we were thinking about, is there some utility in the systems view of the work that we want to do? And I'm wondering anything that you might want to add, Ken, that we could work upstream. We talk about working upstream in the system. We're talking about working with our suppliers for downstream benefit, which is what we give the people we serve.
Yeah, and I think, and we didn't discuss this, but when you say upstream, downstream, it also makes me think of the opportunities to look midstream, because for many communities, we're in the middle of this. Our babies are dying right now. Our mothers are dying right now. And so, and I think of these Healthy Start workers, many of them are doing incredible work, midstream work, right? So that catching the harm that's coming from above, and they're also working to bring up people to get them to the top of where they need to go. And so that midstream, that service delivery, that's powerful just to see it laid out here. But yeah, but just how we can influence the systems and those actors within those systems, because that's the system needs the actors to kind of facilitate the system. So we can do some change and influence and transformation in thinking and behavior, then we can also have more concentrated work midstream. So upstream, downstream, and midstream work.
Thank you. Next slide. So when we think about the system of profound knowledge, the authors of the Improvement Guide have simplified it a little bit for us. And they've said we can ask these three questions. What are we trying to accomplish? What is it we want to do? Who do we want to do this with, or who do we want to serve? Who are we serving? When do we want to have it done? And how much improvement do we want to see? Could we put a stake in the ground about, do we want a little, a lot? You know, how much reduction in infant mortality or maternal deaths do we want? And really saying it so that we could begin to measure and see if, and really uncover it if we're able to do that. So one of the things that I would like to begin to do is to explicitly interrogate what we do for equity. And by that, when we write these fancy aim statements, we really need to say, who is this serving? Is it really serving women and families and children? Or is this serving an agency or a particular stakeholder? Or is this really serving the feds? So I think when we start interrogating what we do for equity, it's going to get hot in the kitchen. So it's the only way I can say it. Next slide. So I was thinking you guys might want to interrogate your AIM statement. And here's an AIM statement I just made up for us to interrogate. The greatest healthy start will improve maternal health of women of color in our service area. So what do y'all think? Do you think women of color is very specific, or is it general? Do we know who these women really are? Do we have a sense of our service area? And what do we mean by improve? These are tough questions. And what do we mean by maternal health? So one of the things that I learned in We All Count is that we start looking at our AIM statements and we really circle the components of them and interrogate them in a hard, in a way that asks this tough question of whose interests are served. Next slide. So here's an example. So what I'm advocating for is habits of equity interrogation. So for example, women of color. What about women who aren't visibly women of color? Are we excluding them? What about the underserved or the unserved, people who aren't getting any service? Are we talking about mathematical minorities? Are we talking about just exactly who are we talking about? And when we talk about improve, are we talking about better on average, better for most of people who are at risk? Are we talking about closing a gap in inequity? Are we talking about working upstream with the social determinants of health that actually influence maternal health? So exactly what do we mean when we say improve? And then if we say in our service area, well, is that only people that we're talking about? Because I know a lot of you are limited by your zip codes that you serve, or people who live here, people who work here, people who are referred to us. And I know that there's some real ethical dilemmas that you have to deal with when you're referred women who are not in your service area. At least I've heard these stories from you when I'm doing technical assistance. And then are we talking about physical health or mental health? And who's defining health? Who selects the criteria of whether we're healthy or not? So to me, beginning to think about these questions are ways that we bring equity into improvement science. It's not enough for us to say, can you go back 2 slides? It's not enough for us to say, what are we trying to accomplish, for whom, by when, and how much improvement do we want? That's just not enough if we want to bring a lens to our work that can deal with structural racism. And I'll stop and make some room for y'all because I'm advocating hard and I feel it, and I need to tone myself down a little bit. I'll make space. Anybody want to react or write on or say, no, this isn't it? So if we were in a room together, I would have you turn and talk to your neighbor right now about this and what your reactions are and how difficult would it be to start interrogating our work this way, or how you may do this anyway. And you may be already where I aspire to be with bringing these concepts to improvement. I would really let you talk about it, but I can't do a turn and talk right now. So I will move on. Next slide. So one way we could make our aim more specific is we might say, and I'm going to ask you to look for what's missing. Over the next 4 years, The Greatest Healthy Start Center wants to measure and improve postnatal follow-up care for women in our agency by defining what matters most to them in the prenatal period for the year after birth. We want to understand the differences in access to care and self-management support for postpartum mortality and self-reported health outcomes. So what the women say matters to them by race and by income level. So now this is a more specific aim statement that works at becoming more equitable, and I'm asking, what's missing, if anything, here? And maybe just kill the slide for a second, and we can look at each other. Only a few of us have our cameras on. Does anything strike you? Okay. It doesn't
It
have
feels like it's kind of missing like a tangible goal. Like it's saying we want to do all these things. And that was the point. Maybe we're just trying to reach abroad, but like it felt like it was missing, like, how do we know that we've reached our aim?
Okay, so thank you, Mary. Let's go back and look at it. So I think for me, you're right. And what's missing is because I was thinking if we ask women what matters most to them, they'll tell us, and that could be what we measure and set our goals around. Or we could say, if we identify what matters most to women, that we help them achieve that, or we wonder what percentage of them achieve that. But you're quite correct. Thank you. I mean, your point is well made.
No, that makes sense.
But still, we would need to have a really good aim statement. We'd need to dig deeper with these women, and ask them, what should we be measuring to understand if you're getting better follow-up care?
And Jane, if I can just jump in on that piece, because it's interesting, right? Because we all know follow-up care, postnatal follow-up care, and we have the regimen. We know what that is, and we're after in that follow-up. But I'm just thinking of where this follow-in care, do we know what the women are planning and what's up for them? So we're intentional about what we're following up with, but we don't really know what maybe they have a plan also for the next year. When do we check in on that? But if we don't know that, I wouldn't check in on that. And so again, when you talk about equity, the inclusion, has that follow-up care been negotiated with them? I know you have these 3 things we want to do over the next 3 months, but I'm also looking at these 3 things because now that I've had this baby, I had to deal with housing stuff before I went into the hospital. I have to follow up on that and finish moving. I have to make sure the kids, so they have all of these things going on immediately, but it's like we don't pay attention to any of that. We just, I'm here for your visit and I need you to do X, Y, and Z. So some way of, to your point, engaging them, their voice there. And so it's follow up and follow through, because I'm here to do my piece that I promise as on the medical side. And I'm also want to check in with you on what I've learned you need as we move forward in these months. So the engagement would shift if it was more kind of inclusive type of follow-up plan. So I just had to say that because that's what's coming up for me.
Thank you. And I love this phrase, follow in. And we know 1/3 of women that die in the year after birth, of Black women who die. It's in and there's a third of the maternal mortality is in that year after birth. So such an important time. All right, let's carry on then, and then we'll wrap things up. So I think naming and specifying what the benefits and rewards are, not just for the women that we serve or the women that benefit from what we offer, but what are the benefits to Healthy Start for working on this project? Everyone working on the project needs to think about who's benefiting. Because if the benefit flows to me personally, because I'm going to write my dissertation about this project, that needs to be articulated so everybody knows it. If our team is trying to get a prize or present at a national meeting as the benefit of working on something unique, we need to say that. If our Healthy Start is working on this because we're on review by our project officer, and this would get us off review, these things need to be specified. And really, I think, interrogated, and because they're going to drive what gets measured, and that's going to drive sometimes what gets done and worked on. So this is an important step in, I think, in the equity improvement work. Next slide. So also recognizing and naming what kind of constraints your projects might have. So are there time constraints? Are there money constraints, resources? We lack certain expertise. We don't know enough about maternal mortality. Or are there laws and standards that we have to follow, or maybe policies that the person who holds our grant has? So I'm working with an agent. I was working with one of the Healthy Starts that could not, giving TA, that could not raise money for their program because they sit inside a huge not-for-profit and they have to have permission because they can't compete with the not-for-profit for fundraising. So all of these things, these constraints or limitations, need to be articulated so that when we think about the project, not just can we be realistic, but we look at what are these and is there anything we can do about them, and interrogate them with this equity lens and inclusive and diversity lens. So these are things to do when you start your project and set your aim. Next slide. So here's an example of a measurement statement that you might make, where you actually combine the rewards and restrictions with the measures and the aim. And you say, we're collecting data as part of our maternal portfolio in order to ensure women have what matters most after the birth of their infant, for whom, for women enrolled in our Greatest Healthy Start, when, and over the next 4 years, within the bounds of whatever our budget is, a $20 budget, with these restrictions, and you list them, with these benefits, for our funders, for our clients, for our team, for our evaluator, because sometimes your evaluator has something at stake. So this is just a template format that you could use to help you organize what you've developed. Next slide. So questions to ask before you begin your project. How was this project selected, the subject? Who selected it? Is data that we're going to collect related to compliance? What we're required to report to our funder? Is it related to oversight, or is it co-designed with the people who are going to report the outcomes for themselves? Who stands to gain from the project internal and externally? And what are the products that we're going to make? What specific results do we seek, and whose interests are served by that? And these are tough questions. If we were able to be together for 3 days, you would actually take one of your projects like you did with the balls and peel it apart with these questions. And will the results be shared, and if so, with whom? So who are we sharing data with? And how will the results be used? And we know that results, we know what an important question that is. Are they going to be used to persuade, for future funding, affirm current norms, affirm our racist structures? Are they going to be used for decision making, policy change, program expansion? How is it going to be used? And how are the results going to be communicated? And we all count, they even go so far as to say, who gets to say how the data is visualized and what good data visualization is or not. Next slide. So I'm going to stop with this slide. Data is not objective, and we pretend like it is. Data has a point of view, and I'm talking about quantitative data here, because those of us who are qualitative researchers, we know this. And when we do projects, we actually declare as much as we can what our assumptions are, what our point of view is, and we acknowledge that our data is not representative, it cannot be generalized. But with numeric data, we pretend, the canon of improvement folks, pretend that data is objective, but actually there is a viewpoint, a worldview that is represented in the data that we collect. Not only what we collect, but how we collect it, how we calculate it, how we even figure out the averages. Average of what? Average of the women in our center, average of all Black women, average of all women of color. So on whom is this data collected? How do we analyze it, and how do we present it? These are all embedded and infused with a worldview, and there's power behind that worldview, and making that explicit is one way that we can bring an equity lens to our work. So I'm going to wrap up here, and we will continue our academy. You'll have some work to do next time we come together, and you have some assignments as well if you are interested in developing some of these skills. And Lisa's going to fast forward to the homework and to the end of the presentation. So you're going to get a handout with Deming's 14 points. Think about them if you want to. Start paying attention to any blame language that you hear or you participate in or you're tempted to do, and Lord knows I do it. And draw attention to what could be the process that's failing instead of the person. And then think about looking for opportunities to ask, for whom are we doing this? Is this for the client, the agency, the funder? When you're doing a task, draw one of these power maps. Start a learning journal if you're ambitious and that's the kind of thing you like to do. Be as brief as you like, or as take notes about some things that you're noticing as you're in the academy. How others react to your inquiry if you start interrogating work with this equity lens. And if you have time and passion, try drafting an equity project aim statement. And later, I'm going to share some tools that we use in improvement work that are actually designed to be inclusive. And that'll be an assignment after the next academy. And this is all optional. These are just some things that you might do for yourself.
Can I ask the question?
Yeah.
Yes. Preceding this training, I was in another training called The Attitude of Inclusion. And in that, it was talking about how do we include fatherhood, like into our work. So the questions that you had posed a few slides back, it was asking questions about the mother, it was asking questions about the baby. And I'm hoping that maybe we can ask some questions about the father in that segment as well, since that seemed to be absent.
Yes, and we can modify our aim statement to include fathers. Absolutely, we can. Thank you.
Thank you.
All right, thank you so much, Jane. So we're just going to run through a couple more closing thoughts and next steps before we end our session today. So again, we're going to point you to the Healthy Start CoLab, a place where you can connect with your fellow Learning Academy participants, as well as Jane Taylor on the Healthy Start CoLab. We have created a page specifically for content that comes out of this QI Learning Academy. So if you don't have a CoLab account and you'd like to be part of the CoLab, please feel free to send an email to healthystart@nichq.org and we'll get you set up with an account. If you have any questions on how to access CoLab, how to get to that QI page or anything like that, also feel free to email healthystart@nichq.org. Next slide, please, Lisa. Our next QI Learning Academy session will be on Thursday, March 18th from 2 to 4. We do have registration up on the Epic Center website, so you can register there, and we will be sending out reminders prior to that session, but just want to note so you can all save the date. Next slide, please. Next, we have started to implement on the Epic Center each month a brief list of deadlines and events. So as you can see, this shows all of the events that we'll have in March that the TA and Support Center is hosting or is a part of. So that's available to you all on the landing page of the Epic Center. If you have any trouble finding that, again, feel free to reach out to us via email. Next slide, please. And lastly, we are looking for feedback on our first Learning Academy. So if you could take a moment to either scan this QR code with your phone or visit that bit.ly link over to the left. We really would appreciate your feedback as we continue with this Learning Academy and on to more in the future. Can we chat it in? Absolutely. All right, so that link is also in the chat now. You're welcome. So we'll just leave this for one more moment if anybody can, if you'd like to scan or just click that link. And I believe after this we'll be all set. So Ken or Jane, anyone have any final thoughts before we close today?
Over to you, Ken.
Yeah, I just want to say thank you to everyone. It's exciting. I recognize a lot of folks today, so I'm really happy to see this group that is assembled for our very first Learning Academy. This has been great. I'm looking forward to the other sessions with Jane. And again, if you need further assistance or need some one-on-one TA on QI, Jane is also available as one of our subject matter experts. I comment again, it was great to have Art James with us, and someone like that takes time to be here for something as important as this was great also. And our Najee, it's always good to have you. I was on the last training call as well, so it's good to see you taking in all this good stuff, brother. And they're gonna have to give you a raise soon because you just started a Healthy Start a short time ago. So great job to you and to all of you that made time to be here today. So thank you all once again.
All right, you can go to that next slide, Lisa. Okay, just a final thank you to you all for joining us today, and we really look forward to seeing you next time. Hope everyone has a great day.
Bye, everybody.
Take care, everyone. Thanks, Tess.